All right, so we'll get started. Welcome everyone to the stress management webinar. Welcome to our second series on wellness within. Today we are talking about stress management for cancer patients and caregivers. These webinars are very informal. And the goal of it is to really provide you with strategies that you can implement to help move you forward in your wellness journey. Many of you do know who I am, but for those of you who don't, my name is Dr. Wendy Garber-Mayo. I am a nurse practitioner, oncology nurse practitioner. I've been in oncology for over 20 years, and I'm also the CEO and founder of Collaborative Cancer Care. Collaborative Cancer Care is a practice where we help support cancer patients, caregivers, and survivors around emotional and mental support, advocacy, and education. So, something you may not know about me is I have coined myself as the stress solution strategist. I do a lot of work in stress management with healthcare professionals as well as cancer patients and caregivers. So, with that, I want to move on to our topic of stress. And I know we're virtual, but I want to make this very interactive. So I will be asking you questions. So please use the chat. And I want to ensure that you have a paper, pen, a notebook, or something to write with, because I want to give you strategies that you're going to actually implement today. You're giving me one of your most valuable assets, which is your time. So I want to make sure you're leaving here with something that will move you forward. And I also just want to note that if you hear something here and you're like, oh, I already know that, that's not going to help me, share it with someone else who may not know. So you're here for yourself and also the other people in your world. So let's just do a gauge of how many of you are feeling some source of stress. Put a one in the chat if it's yes, put a two in the chat if it's no. And I ask this question because stress is inevitable. We all experience stress. We live in a world full of stress, especially now. There's a lot going on in the world, a lot of uncertainty, a lot of fear, a lot of change. And many times we can't control the change, the uncertainty we're uncomfortable with because we don't have control over it. But stress is normal. It is a normal life response, and all stress is not bad stress. We have good stress and we have, stress that's unhealthy. And we're here today to talk about the unhealthy stress. So, what I want to do is I want to define what is stress, because stress is a personal phenomenon, and it's an interesting phenomenon because it's something that we experience that we can't see. I can't see stress. I can't feel it. It's like intangible. However, it definitely impacts our lives. It impacts how we show up, how we don't show up. So it has a huge impact on our lives. So stress really is an imbalance. And I like to describe it as life or someone or something is requiring something from you. And your perception is that you don't have the resources or capacity to meet the demand. So stress is an imbalance. It's life, someone, something is requiring something from you. And perception, that's the key. Perception, your perception is that you don't have the resources or capacity to meet the demand. There lies stress. And there are different types of stress that we have. We have acute stress, which is that's our healthy stress, that's fight or flight. Our bodies are wired with the stress response, and that's a healthy way of our body really protecting us from harm, right? You always hear about the lion, and if you see a lion, you go into fight or flight or freeze, right? But that's our neurological system. It's built that way. So that's a good stress. We also have episodic stress. Episodic stress is stress for a period of time. So I'd like to describe this as, let's say, Example, this presentation. So I'm preparing for this presentation. It may be stressful. After I, finish this presentation, there's no more stress. So it's done. It's for a period of time. Then we have eustress. Have you heard of eustress? Many people know what it is. Some people don't. Eustress is exciting stress. So that can be like a surprise party, an engagement, something exciting, right? But you're like surprised, right? And it's a type of stress, but it's a good stress, but you still have the same biological response. And then the stress that I want to talk to you about today is chronic stress. Chronic stress is the stress that you feel like is never going to end. And I like to call it the stress cycle. You enter this cycle of stress, and a lot of us live in this cycle of stress. And while we're in this cycle, things are happening in our body. So stress can be detrimental to our health. So I want to take a moment here, and many of you put a one in the chat that you are experiencing some type of stress, but how would you define stress? How would you define your stress? Because like I said, it's personal. So is it overwhelmed? Like, and there's no wrong answer, but I want to know how you define it because the way you define it, someone else may define it the same way, right? So how would you define stress? In one word, two words, but let me know in the chat. Let us know in the chat how would you define stress? And I always say, like, as a child, I always knew when my parents were stressed, but we never talked about stress. We never talked about stress management, but you can feel it. It changes, it shifts like the environment, the energy changes. So we have some things suffocating, uh-huh. Unrelenting pressure. Yes, yes. And this is important to understand because you have to be aware when you're under stress. When I get under stress, I feel it here, and sometimes I feel it here. When I feel it here, it's really bad. It feels very heavy here, very heavy, and then I just can't get comfortable, but it's all here. That's where I feel it. And it's that it's a very uncomfortable feeling, and that's my sign that okay, you got to do something. You got to do something. All right, thank you for that. And I want to talk to you about two ways that stress kind of show up in our lives. And I want you to think into this too. The ones who said they're stressed, I want you to take some time right now and I want you to write a note to yourself as to what are you stressed about? I want you to write it down. I want you to capture it in your notebook. What are you stressed about right now? And that's important because it creates distance between you and the stressor. Many times stress is going on in our minds. It's just going on and we're in the cycle and we're in our minds, but writing it down is very important. That's why journaling is so powerful. But I want you to write it down. And then I want to talk to you about the two ways stress show up, the two types of stressors. So we have external stress and we have internal stressors. External stressors are things that are happening externally, things that we can't control. There's a lot of external stressors happening now because politics, whether it's, politics, things changing, it can be a diagnosis of cancer, it can be that you're a caregiver, it can be that you just lost someone. These are things that are just happening. No one's asking you a question, things are just happening around you, right? And you feel like you have no control, and you don't because they're external to you. And the number one stressor, and I'm gonna test you here. What do you think the number one stressor is? What do you think the number one stressor is? I'm gonna tell you, but I want to kind of get your thoughts on what is the number one stressor. All right, I'm gonna tell you what it is. Yourself. Yeah, close, close, close. The number one stressor are people. People are our number one stressor because we can't control people. And sometimes that's hard. That's hard for us to accept. And it's something I always say to myself. I always say, like, if everyone behaved like me, this world will be a better place, right? Don't you feel the same way sometimes? But people are our number one stressors because we can't control them. and people cause a lot of chaos in our lives. But with external stressors, you're not in control of them, but you are in control on how you respond to them, right? Remember, the definition of stress is our perception. So how do we respond to these things that are happening? That's in our control. And then we have external stress, internal stressors. Internal stressors are happening internally. We have more control over them. Internal stressors are like our thoughts, our lifestyle decisions, our limiting beliefs. Internal stressors are important to understand because they develop over time. I mentioned that when I was younger, my parents didn't talk to me about stress or stress management, right? But I knew when they were stressed. So I didn't grow up really knowing about stress, right? But I knew how people responded to stress, and I picked up some of those behaviors, right? You model some of those behaviors, but those internal stresses can develop on how you were raised, what people said to you, what people didn't say to you. Did you have affection? Did you not have affection? Were your thoughts valued? Did people ask you about your thoughts, or did you just ruminate on things by yourself, right? So those type of stressors are happening inside of us. And what happens in life is that, we encounter something, right? We may encounter, an external stressor, and it triggers us, and we go back to being 10 or 15 or 20 or 6, right? Because it brings us back there. But those internal stressors are really here. They sit here in our mind. And it's really important to identify what those are so we can work on them. So we can really work on breaking those cycles of those internal stressors. Now, I asked you to write down your stressors. Now, what I want you to do now is I want you to categorize them. Are they internal or are they external? Or are they a combination of both? Are they internal or are they external? And after you finish capturing them for yourself, let me know in the chat, do you have more internal stressors or external stressors? And it can be a combination because external stresses can become internal, right? They definitely can. They can start to wear on your mind. Yep. Internal and external. Yep. Janet, thank you. Thank you. And it doesn't matter the response, but what's important to understand about stress? Thank you, Michelle. External. What's important to understand about stress in that stress cycle is that when we're in the cycle, we are releasing hormones. We're releasing hormones. The main hormone is cortisol, we have adrenaline, we have all these hormones that we're releasing. And I want you to think about, if we're releasing all these hormones into our body, it must be taking up space, right? Because we always talk about equilibrium, equilibrium. If we're releasing a lot of stress hormones, that equilibrium's off. So that's why things start happening when we have the chronic stress. So there are chronic related illnesses that can happen, such as anxiety, depression, insomnia, right? Substance abuse can come from being in that stress cycle. Diabetes, peptic ulcers, acid reflux, impotence in men, infertility in women. And they're also looking at how stress impacts our immune system, and looking at how chronic stress can sometimes be linked to cancers. There's a lot of studies on breast cancer and stress where they looked at women, and women, and you can look this up. It says that, women said, it was the most stressful time of my life when I was diagnosed, because stress impacts our immune system. Our immune system can't function at its optimal level if we are stressed. Now, when you think about when you're stressed, you ever get a little cold, you get a little sniffles, just not feeling great because your immune system is not working well. You just don't feel great. But that's why we have to really understand our stress triggers, understand when we're in the cycle, And more importantly, understand how to get out of the stress cycle. Now, how do you get out the stress cycle? And the things I'm going to say are not novel. These are things that, yeah, you want, because your body is tired, Sylvia. Yeah, your body's working overtime being in that cycle. Yeah, your body wants to sleep. You want to rest. You want to rest. Some people eat, right? But it all shows up differently. But it's important to know what is the sign for you and what's the indicator that you need to shift and do something different. You need to pivot. So some of the evidence-based things that you can do, which you heard of, right, is movement or physical activity. So moving your body. I like to say movement, not physical activity. When I think of physical activity, I think of running on a treadmill or lifting weights, something like that. And I'm not going to do that, right? But movement. Something as simple as standing up and just moving your arms like side to side. Just moving your arms, right? Bending over, up and down, like just move your body because stress lives inside of us. And that's why we get like the muscle tension, but because the hormones are all inside, right? It's settling in our muscles, but you need to move. That movement is so important. Breathing is so important. Resetting your nervous system, those deep breaths. And people poo poo that, but that is a way to just really reset and recenter yourself. Breathing is very important. Positive social interaction. Are you connected with community? That's social wellness. Do you have people you can tap into? Do you have someone you can call that's going to give you that boost you need? And in saying that, it's also important to know or be aware of the people who drain you, right? Those people you have to stay away from when you're stressed, right? So it's important to know that too. Laughter. Laughter is so important when we are stressed. And I always say it's important to know what makes you laugh. I know someone on here was asking for a joke the other day, right? But that laughter, it's so important. Affection is also a way to kind of come out the cycle. Like sometimes you just need a hug. You just need a touch, or just someone to just show you some affection, some love, that you are loved, you are cared for, you are seen, right? But who is that? Do you know who that person is? The next one I love, it's one of my favorites, is crying. A good cry is a way to get out of that stress cycle because we're resetting our nervous system. We're resetting ourselves. But a good cry, and I always say a good cry in a hot shower, perfect. And then the last one I want to talk about is creative expression. So this is writing, drawing, coloring, but really creating something, going fishing, being in nature. Yes, yep. So that's good that you know that, Sylvia. Yes. Yeah, that self-awareness is so important. When I talk about stress, I usually talk about it in terms of emotional intelligence. And that's why I keep saying that self-awareness is one of the first pillars of emotional intelligence, but it's knowing yourself. So getting out that cycle, those are things you can do like immediately just to kind of reset. And it puts you in a place where you're back in control, right, of what's going on. And before we move on, I want to ask, how many of you are on your calendar? Are you on your calendar? Do you have an appointment with yourself, for yourself, on a routine basis? Are you on your calendar? No, Janet. Yes, Linda. Yes. Yep. No, no, no. Okay. Yeah. No, okay. Many of us are not. Many of us are not on our calendars. But I'm gonna give you a challenge. I'm gonna charge you. I'm gonna charge you at the end of this. Okay. I'm gonna give you the 5 for 5 for 5. Okay. But I want to kind of just go into routine stress management, yoga. These are things that you can do. But the number one way to really manage your stress is taking back control or taking back your power. And that is really managing your mind, right? Because I said it starts up here. It's related to perception, but it's all here, right? It's all here. All in here. But it's how do we manage our mind? How do we nurture our mental wellness, our emotional wellness, right? our thoughts, our beliefs, right? That become our behavior, how we process things, but how do we nurture our mind? Yeah. Ooh, I love that. I schedule it daily as me time. I love that. And this is the charge I have for you. So one way to really nurture and manage your mind is scheduling it. And I love that you do it daily, Linda. And the charge that I'm going to give you is 5 for 5 for 5. So for 5 days, I want you to take 5 minutes and I want you to do 5 things. 5 days, 5 minutes, 5 things. And how you're going to do this is you're going to put yourself on the calendar. You're going to put yourself like Linda. You can put it as me. I like that. Let's use Linda's example. Me time. Me time. Okay? And people say, well, what do I do in the 5 minutes? So you can do whatever you want to do, but here's the 5 things I want you to do in the 5 minutes. And it may take a little longer, but that's okay. Be gentle with yourself. But I want you in those 5 minutes, what I want you to do is I want you to sit. I want you to sit down. Sit down. I want you to breathe. I want you to take 3 deep breaths just to reset yourself. I want you to verbalize a positive affirmation about yourself. I am awesome. I am strong. I got this. Whatever it is, I am loved. I am blessed. Whatever one affirmation. And I want you to say it. I don't want you to, you can write it down too, but I want you to verbalize. I want it to come out of your mouth. And then I want you to write one thing you're grateful for that day at that time. And the last thing I want you to do is I want you to write down and capture what is one thing you're looking forward to? What is one thing you're looking forward to? And before you do these 5 things, I want you to time and I want you to date the page. Okay? So I want you to sit. I want you to breathe. I want you to say a positive affirmation to yourself. I want you to capture one thing you're grateful for. And I want you to capture what is something you're looking forward to. And if you can't think of something you're looking forward to, I want you to think about something you're going to do to, look forward to, whether it's a phone call to someone to reconnect, whether it's going out for a coffee. I know someone on here loves Starbucks, right? Treating yourself. But what is something you're looking forward to? So I want you to do that just for 5 days. 5 days, 5 for 5 for 5, 5 minutes, 5 days, do these 5 things. Or if you don't want to do the 5 things, you can do something else. Like Sylvia, you said crochet. That's wonderful, wonderful, wonderful. And as you continue to do this, I want you to let me know how you feel after the 5 days. I want you to let me know how you feel. But getting into a groove of spending positive time with yourself is so important in one way you can manage stress. Something else I will give you is a framework that I use when you are really stressed and you just can't quiet the mind, right? And it's my stop framework. And I will email this out because I have it in a format like a infographic. But the S is for stop. You got to like stop. You just got to stop, right? You got to stop the mind, stop the body, just literally stop. And the T is for think. Think about what it is that is going in your mind. What is troubling you? What is troubling you? The O is for options. What options do you have to alleviate or mitigate this thing that is troubling you? This thing that has you so stressed out. But what are your options? Are your options that you need to make a phone call, you need to reframe, you need to, what is it that you need? Like, really, what are your options? And the P is for how do you put that option into play? So what's your plan to put it into play? And then the last P on that is actually to actually do it and proceed, to kind of move on with your day. But like you need to figure it out. Sometimes you're so stressed, you don't even know why you're stressed. And really kind of sitting down and stopping and thinking about it and writing it out helps you process it. And many times when you're writing down all these stressors, it's more than one. So I ask people to categorize it. You categorize it. Which one is which one keeps coming up for you more often? One, two, three, four, right? And that first one, what do you need? How can you get that? How can you operationalize that? The second one, what is it that you need? And it may not totally erase the stress or alleviate it, but how can you just make it a little better? How can you just make it a little better, like move towards better? One thing. Because when we are stressed, no one can really help us, so to speak. It's really up to us to manage our own stress because it's happening inside of us. It's our stressor. So it's really about us taking back our power, taking back our minds, and doing what we need to do to manage our stress so we can really stay out of that cycle. Now, because many of us live in the cycle, it's hard, but with practice, we can definitely do it. We can do it. And even being here, it shows that you want to do it. You want to manage stress. You want to manage it. And it's really figuring out what works for you. And figuring that out, we have to try to figure that out on an ongoing basis because different things come up in our lives, right? Different things come up in our lives. Family, things are happening. In the world, things are happening. And as humans, we evolve. We're evolving, right? By our experiences. So it's important that we take intentional time with ourselves to understand what is going on with us and honoring ourselves. And also knowing that you don't have to do it alone. Now you have to manage it and you have to, put the strategies in place. So you have to reach out, but you don't have to do it alone. And that's why community is so important. We have cafe conversations, a place where you can build community, meet people, but there are support groups. There are so many things out there. Or, reconnecting with your community, maybe your friends or family members. But that connection is so important. So I want to take some time and I want to open it up for questions. If you have any questions, you can put them in the chat, and we can discuss them. And thank you so much for the engagement in the chat. I love it. Any questions? Anybody want to share their stressor in the chat? And wait a couple of minutes and see. Diagnosis. Yeah. Yeah. And a cancer diagnosis is a serious stressor. It's a serious stressor, and sometimes it takes up all of our capacity. And one thing that we try to do at Collaborative Cancer Care is really help clients and patients understand that. And you said this the other day, Janet, is that you have cancer, cancer doesn't have you, meaning that, yes, it's very stressful, but there's still life to be lived. There's still that hope. There's still purpose. There's still impact. You still have a gift you have to share with the world, right? So how do we make capacity for that while understanding the diagnosis can be so stressful, but you are here, right? You still have so much to give the world, right? So how do we tap into that? Thank you for sharing that, Janet. My stressor seems to center around doctor's appointments and labs. Yes, those are external stressors. Yes. Yeah, so those are external stressors, and maybe managing expectations of what it's going to be. What do you have control over, right? Like how can you show up at a doctor's appointment prepared with questions, which I know you do, right? But that anticipation, how do we control the mind before those appointments or after we get the labs? But controlling the mind. And again, I think it's about taking back that control and power. So we already know that the doctor's appointments and labs are going to be a stressor. So the next time we have a doctor's appointment, what are we going to do different? How are we going to pivot and shift, right? I'm concerned about my antidepressants being taken away and being sent off to a wellness farm. Oh, yeah. So you're anticipating, yeah. So that's something that may happen that is a concern. And I think it's getting more information on that. But that's an interesting one, Michelle. I want to know more about that. There are no treatment options for me. Okay, yeah. That's an interesting one. That's an interesting one. Yes. I want to know more about that. How do you keep your power longer? Others can be stronger. How do you keep your power longer? Yeah, I think it's practice, Sylvia. I don't think it's because you may be able to keep it longer. You may have been able to keep your power longer, maybe 6 months ago, right? And maybe right now it's just really hard for you to do that because of what's going on in your life. And that's okay. And that's okay. But it's how do you get the support you need to help you maintain as much power as possible? And I want to say this that I know I'm talking about stress management like it's not easy, but it's possible. Not easy, but possible. And it's not a switch that you just kind of turn on and then everything is, peaches and cream. Mm-mm, mm-mm. It's a process. I gave you the 5 for 5. You may do two of them, and that's okay. That's okay. You may do one of them, right? But it's creating momentum for yourself in getting in the right space with the right people. I'm a big component of community, and I like to call it even SAC. So SAC, it's support, making sure you have support, making sure you have accountability, and making sure you have community. With those three things, you can pivot and you can shift your life. Yes. Yes. Reoccurrence. Yes. Reoccurrence. Yes. That is a big one for survivors. Though that's a big one for survivors, reoccurrence. And that's a real that's a real concern. But and again, it's gonna come up, right? It's not you're gonna like just totally shift it away because even the most positive people, right? They have times and moments when they think about recurrence. But I guess I'll say it like this. It's how long do you live there? How long do you live there with the stressor of the recurrence, right? And some days it may be, all day, right? You may be in that rabbit hole, right? All day. But then tomorrow, it's how do you make the shift? And Rhonda, I know you do a lot in the community. You're involved in a lot. But so it's really I like to think about it as like capacity, and thinking about what is it that you want? What do you want in life, despite despite it all? Like what is it that you want in life? And I like to start talking about like your purpose, like what makes you feel alive? What makes you feel alive? What lights you up? Ikigai is a concept, it's a Japanese concept where we talk about like life purpose. And I think there's four or five I can't remember. But I know one of them is like, what does the world need? What are you good at? What can you get paid for? I can't remember the other one, but that what do you get paid for? Not money, not monetary payment, but what lights you up? And how can you lean into that more? What brings you joy? Because sometimes when we're stressed, we forget about those things. We forget about life. We forget about living. We forget about those things that really, get us going and moving. How do you spell, what is that, Michelle? How do you spell ikigai? I think it's Ikigai. I'll send it out in a follow-up email. I'll send out the concept of that ikigai. When your life knocks you down, you also lose yourself. Yes. Yes, Sylvia. Yes, you do. And life will knock you out. Life will knock you out. But then that inner strength is to come back. And the thing is, you don't have to come back right away. You got to give yourself grace to, you can be down. You can be down for a little while, but then how are you going to get back up? How are you going to create the momentum? Yeah. And that's where that SAC comes in, that support, accountability, and community. That's where that comes in. Yep. Yeah. All right, so we have just a couple of minutes. This was really good. Thank you so much for your engagement. Sometimes I give myself the day. Yes, you need that day. And that's the thing. It's not flowers and rainbows every day, and that's okay. And you will be stressed. You will have the body aches and all that, but it's for how long? How long? How long? Right? We're gonna do something on grief as well, and then we're gonna that they'll tie into this. But with grief, you gotta be there for a while. You gotta be there for a while, and that's okay. But don't be there alone, because that's where it can get a little scary, and it's prolonged. When you're there for a long time alone by yourself, it can get very scary there. Um, so yes, but then you have to do the reach out to say, yes, I want help, I want support. I don't want to do it alone. Making that decision is so important. So important. Awesome. All right. So before we wrap up, tell me, how was this session for you? What is one word, or how would you describe this session if you was going to tell someone about it? Let me know in the chat. Let me know in the chat. And I want to thank you all for your engagement. Thank you for being open. Thank you for sharing. I love it. I love it. Thank you so much. Thank you so much. And we'll have another one next month. And I'll send up a follow-up email so you'll have the 5 for 5, the Ikigai, and things I talked about. Um, but thank you. And if you need anything, please reach out. I'll send an email. You can call, you can send an email, and we can, schedule a session. But you're not alone. I'm here for you. I'll speak for myself. I'm here for you. My team's here for you. And have a great day. And don't forget, put yourself on the calendar, even if it's just for 5 minutes. Put yourself on the calendar. All right. Take care, everyone.